I've had a few flat moles that I've lasered 2 times. 2 times. I've lasered it 2 times, but I barely see any difference. The doctor told me that if laser doesn't work for my flat moles, nothing will. But it is possible to get rid of flat moles with excision, right? Yes, right. I'm not sure I would necessarily 100% agree with that doctor. Actually, probably 0% agree with that doctor, saying that if lasers doesn't work, nothing will. That's not true. The thing about doing things like laser for moles is that you're using thermal energy to burn the mole, basically. And if you do too much, you're going to get too much scarring. If you do too little, you get a residual mole. So that's the problem. If you don't do enough, you can obviously get less scarring because you're damaging less skin, but you will then, when the skin heals, the pigment cells will still be there. You need to destroy all the pigment cells somehow. So I would, so a flat mole can always be removed by excision. And going back to the cost of mole removal question, it depends on the size and the location, because you can get very big moles, but most moles are kind of small moles. Let's be honest with ourselves. Most moles are small moles, but any size mole we can certainly talk about removal. If a very big mole, you might be saying the risks outweigh the benefits, but that's kind of up to the patient, really. But generally speaking, any flat mole can be removed by excision, and I would say excision is the best way to remove it. I would say that. I do say that. And I'm not just saying that because we do it, because I don't mind who does it. You can have anyone do it. I'm saying that because I think it is the best way to remove them. You can be very, it depends on the type of mole. Sometimes we do shave excisions and stuff like that. But a flat one, you can't really do a shave excision. A flat mole, a flat pigmented lesion, probably is best to be sent for histology, number one, so we can be sure that it's nothing sinister. And number two, you can be absolutely sure that you're removing it. There's no kind of question that it might come back or anything like that. It's a guaranteed, really, result. So I think, and you can be clear about how much skin you're removing. You do a very minimal margin usually for a benign mole, and so you get the minimum scarring. Whatever you do, there's going to be some scarring, and I think anyone who says there's no scarring is like, well, the scarring might be so good you can't see it, but you can't really say there's no scarring. There is a kind of, especially if it's a full thickness injury, whether that be with acid or laser or a knife or a spoon, scraping it or whatever. If there's a full thickness injury, there's going to be